The number one cause of death in the United States for those between 18 and 45 is still opioid overdoses, and police report that fentanyl use is increasing. State law enforcement officers in Montana claim that cartels deliberately target more remote communities. So, in today's video, we're going to be doing a deep dive into how Mexican cartels are in control of the rising deaths due to the opioid overdoses. Stay tuned to the end of the video to learn all about it. In comparison to 2021, Montana Highway Patrol officers have already confiscated 3 times as many fentanyl pills from the streets. Patients with significant pain are frequently treated with fentanyl. However, individuals are utilizing it to get intoxicated, which is frequently punishable by the death penalty. During the COVID-19 outbreak, Marla Olinger's son relocated to the Blackfeet Indian Reservation in Browning, Montana. Olinger thought that her son was wonderful. He was a reliable companion. He made a wonderful brother. However, something else happened in January 2022. Olinger claimed that she had noticed her son's lack of focus. Justin suddenly became reclusive. Olinger claimed that he began to object to his family gatherings, which worried her. She said that she had sensed she would never set eyes on her son anymore. Olinger was not wrong. Justin Lee Little Dog, her 33-year-old son, died from a fentanyl overdose on March 7th. She claims that the medical examiner from his autopsy revealed that he had 15.5 milligrams of the substance in his system. Fentanyl's estimated human fatal dose is 2 milligrams. She's been struggling with that reality every day when she wakes up in the morning and returns to bed every night because she believes she lost a significant part of herself. Her baby was gone. This was her first child. According to Knudsen, the cartels are prioritizing Montana because they know they can make huge profits here by providing an item that costs virtually nothing to produce. A blue M30 tablet, according to him, would cost anywhere between $10 and $15 in Salt Lake City, Denver, or Phoenix. Since Montana is further away from the border and has a fewer supply of illegal drugs, the price can reach as high as $100 there. It's important to realize that the cartels in Mexico can create these fentanyl tablets for pennies on the dollar. According to Knudsen, the cartels have a significant financial incentive. According to Knudsen, a handful of fentanyl tablets shows a major police raid several years ago. However, police are now frequently catching miscreants moving with 10,000 or more tablets. He claims that amount of fentanyl would be sufficient to eliminate each man, woman, and kid in the state. The chief medical officer of Community Medical Services, which runs 50 opioid treatment facilities nationally, together with 4 in Montana, is Dr. Robert Sherrick. Fentanyl has seized control, he claimed. About 70% of the individuals coming in with an opiate addiction, according to Sherrick, test positive for fentanyl. According to Sherrick, these negative effects associated with the medication is the main obstacle to therapy. He stated that if anyone has a major drug crisis, whether it be fentanyl or any other opioid, they have to solicit help and begin immediate treatment to get better. According to him, addicts who want to obtain medication to disentangle from drugs must enroll in opioid rehabilitation programs. He maintains that when patients use medications for treating opioid addiction, they're not substituting one addictive behavior for another. Fentanyl, according to Sherrick, has a lesser chance of succeeding in treatment when contrasted to other opioids because it's so addicting. Addicted people are optimistic that they might receive assistance and transform their life, say those who are relatively close to them. Christy Farmer, a native of the Blackfeet Indian Reservation, was arrested and jailed for drug trafficking after developing a methamphetamine addiction. After overcoming her addictive behavior, she now advocates for rehabilitation in her neighborhood. She's associated with Olinger, whose kid died in March from a fentanyl overdose. Farmer claims she felt terrible after her cousin Marla's son's death. She reasoned that she was discussing prevention efforts, and Narcan at the time was the reason. She questioned whether or not she could have been assistance. Before the epidemic, according to Farmer, there was a movement to increase the concerns about the negative effects of opioid usage. But COVID-19 halted those initiatives. Rehabilitation facilities are available, although occasionally there is a long wait list. The facilities are also far apart. Either that or there's not enough personnel. She said that she wishes more programs and supplies would be made accessible so that our users will be willing to visit one of these locations, have an examination, and receive the immediate assistance that they require if they wake up one day and decide that they require treatment. The Department of Public Health and Human Services in Montana provides information on seeking support for drug rehabilitation. In terms of the opioid problem, fentanyl poses a more difficult challenge than those posed by heroin and prescription opioids. The danger posed by fentanyl is extensive. Pharmaceutical manufacturers have been manufacturing it as an approved pain reliever for years. However, it's also manufactured illegally in China's black market. Contrary to prescribed analgesics, counterfeit fentanyl is harder to identify, and it's not typically diverted from the official market. Neither is it completely equivalent to the heroin black market. The public web or the dark web can be used to buy it. China produces the raw ingredients sent to shady laboratories in Mexico to create fentanyl. Vast quantities of fentanyl and other drugs are being smuggled across the southern boundary from Mexico by drug traffickers. Drug dealers in the US receive shipments of fentanyl not just by mail, but also via express from China. To support their activities and transportation channels into cities, neighborhoods, and the lives of the populace, transporters as well as indirectly or directly receive deliveries from China or pill machines that can produce large numbers of pills every hour. Genuine fentanyl is not regarded as a heroin or oxycontin substitute. Would be too strong. A person could be killed with just 2 to 3 milligrams. And that's been proven. To improve the effectiveness of the chance of addiction, it is frequently added to heroin, cocaine, or fake substances. What's more alarming is that users of these medications might not even be aware that they're ingesting fentanyl, much less understand what it is. The lethal menace of opioid misuse is considerably more lethal by fentanyl. We only know that there are more fentanyl-related deaths than there were previously. And how can we confront this danger when we don't recognize how rapidly it's expanding? The crucial question. Worth asking as everyone collaborates to battle this constantly developing danger to public health. Additional drug control measures than those directed at heroin and opioid overprescription will be needed to counter this fentanyl problem, which is becoming more complex and widespread. There has to be a swift solution to the widespread issue of fentanyl. To effectively battle fentanyl, everyone has to be on board. And there's a need to think creatively about how to stem the spread of the problem created by fentanyl. New evidence indicates that fentanyl and its chemical variants are the primary cause of mortality. Fentanyl is a third wave in the current opioid crisis affecting the country. As we've stated earlier, that a great amount of fentanyl is being produced illegally in China's black market. And unlike prescribed opioids, counterfeit fentanyl is not predominantly redirected from the legal market, making it difficult to discover. It also isn't quite equivalent to the heroin black market. The drug fentanyl isn't brand new. It's been in existence for a while. However, fentanyl analogs are a relatively recent development. The main cause of this issue is likely the capacity of illegal trafficking to be fueled by the internet. Mexican drug cartels who broaden the southern border have targeted the state of Mexico because there are considerable riches to be earned, as said by officials. Also, according to the Attorney General of Montana, Austin Knudsen, fentanyl overdose deaths have been sharply rising in the state since 2020, and evidence indicates that Mexican drug cartels have been actively targeting Montana to maximize their revenue. A blue M30 tablet, also known as oxycodone pills, according to Knudsen, would cost $10 to $15 in another city, but could fetch as much as $100 in Montana, due to the state's distance from the border, which limits access to the supply of illicit drugs. Since there's so much extra profit to be made, this fentanyl issue is growing and it's only going to get worse. According to DEA figures, a kilogram of heroin might be obtained for $6,000 and sold wholesale for $80,000. Although a kilogram of pure fentanyl costs under $5,000, it can be extended into a 16 to 24 kilogram of product by adding cut chemicals like talcum powder. Cut fentanyl can be supplied at wholesale for $80,000 per kilogram, yielding around $1.6 million. That is a 20-fold increase in the price of heroin. A federal plan to address fentanyl is required due to the obvious and ongoing harm it poses to public health. Families Against Fentanyl, a nonprofit organization, released data in February showing that in only 2 years, the number of fentanyl-related deaths increased in 30 states and more than 3 times in 15 states. Florida had the largest fentanyl fatalities in 2021 with 5,161. While West Virginia had the largest per capita percentage of fentanyl fatalities in 2021 at 64.4 per 100,000 population. With a cumulative of 5,123 fentanyl fatalities, California came in second place. As said by Families Against Fentanyl, fentanyl is currently the leading cause of mortality for Americans between 18 and 45. U.S. Representative Matt Rosendale has recently blamed the state's rising fentanyl trade on failing immigration laws of the Biden government. He claimed that, as a result of Biden and the Democrats' open border policy, fentanyl was able to enter communities and to traverse borders, leading to a sharp rise in fentanyl fatalities in Montana. Finally, the Biden government has promised to implement harm reduction initiatives, enhance rehabilitation, and sabotage the distribution networks of opioid smugglers to tackle the fentanyl fatality pandemic in the United States. And that's going to be it for today's video. Don't forget to, subscribe to the channel if you haven't already, and hit that notification bell so you get updated whenever we post any new videos. Thanks so much for staying tuned, and we'll see you in the next one.